If I have support from my family, I could continue the pregnancy. I don't want to choose abortion.
Each year, around the world, over 21 million unsafe abortions are performed. 99% of these occur in low and middle-income countries. As a result, an estimated 47,000 women die each year, and around 5 million more suffer illness, infection, serious loss of blood, or sterility. In the East and Southeast Asia and Oceania region, over 3 million unsafe abortions happen yearly. The severity and effects of unsafe abortion to women and the communities and families that rely on them are as varied as the social context that influence women's abortion experiences.
A few months before I know that I get pregnant, the doctor told me that I cannot get pregnant.
I've decided to have an abortion because in Indonesia it's difficult to become a single mother because of family and the culture issue. They don't have any strong policy for men to responsible about the pregnancy.
Legal restrictions can drive trained abortion service providers underground. One consequence is the proliferation of informal information and services which make abortion unsafe and harmful.
We were put in the same room, the four of us, and they started to put a plastic tube in our room. I have to watch all the 3 women having abortion in the same room with me, and I was the last.
Information about abortion in the internet, so many, but it's not official, and most of them not responsible.
According to global estimates, laws against abortion do not stop women from seeking abortion services. Restrictive laws merely drive abortion services underground, often leading to services being provided under unsafe and inhuman conditions.
I work in women's health. I would like to see the number of unwanted pregnancies reduced through the effective use of family planning. But I also understand that there will always be a small number of people who have unwanted pregnancies, and those people need access to abortion that is safe and good.
It is now widely recognised that as well as restrictions on access to the abortion procedure itself, social stigmatisation and moralistic views against abortion are among the factors driving unsafe abortion.
If we talk about the debate on being sinful and having the rights to one's body, we have to ask on the definition of being sinful. Who defines what is sinful?
It's based on their moral judgment, not with the intention that they will save your lives.
The biggest challenge for this issue is to change society's perception and attitude towards abortion, from morality and legal issue to women's health and women's rights issue.
It's about breaking the silence and getting rid of the stigma. It's not only uneducated people comes to me. It's not only poor women comes to me. It's not only unmarried women come to me.
Unsafe abortion and the resulting morbidity and mortality is actually a public health tragedy of our times, simply because the technology to make this procedure safe has been available for decades. Unfortunately, abortion rights are very intrinsically linked to issues of women's sexuality, for example, or issues related to gender power dynamics. And in our region, particularly with the patriarchal culture and the society we live in, religious fundamentalism, political conservatism has always tended to make women's bodies a battleground for these issues.
In 1994, at the International Conference on Population and Development in Cairo, the world's governments committed to take concrete actions to help ensure universal access to reproductive health information and services.
The government agreed to protect women's rights, reproductive health and rights. One of them is that women decide how many children they can have, when they have children, the length between one pregnancy to another pregnancy, and with whom they have children. So they agree on that, they sign it, but now it's time to work on it, not only in paper. but make it real with contraception and safe abortion.
If there are no services or facility at all, women still look for the abortion, even that they find the clandestine abortion that can make them suffer or dead.
It could happen to your sister. It could happen to your mother. It could happen to your wife.